It was one of the first countries to be hit with coronavirus. But Singapore's claiming success in holding back the pandemic.
I'd rather be here than almost any other country at the moment.
The island state kept a lid on infections without locking down.
35.7, you're welcome to Duckland.
And it's made people feel safe at work and school. Even as the island grapples with a second wave of infections, people are optimistic.
We are quite hopeful that we will be able to contain this.
For many of us right now, Australia feels like a foreign country, with deserted streets, shuttered shops, gated beaches. But to our north in Singapore, it's not like this. People are still going to work, kids are happily in school, restaurants are open. Life can seem almost normal. Now, we can't travel there, but local television has been chronicling every step of Singapore's fight back. And we've asked some of the world's leading experts how effective it's really been and what hope it can give Australia. In January, as Australia was reeling from catastrophic bushfires, East Asia was bracing for an even bigger disaster.
Health authorities in Hong Kong, Taiwan and Singapore are stepping up prevention measures at borders and hospitals in light of the viral pneumonia outbreak in Wuhan, China.
Their close links to mainland China put them in the first firing line of the coronavirus epidemic. On January 23, Singapore's outbreak began.
We have confirmed the first case of Wuhan novel coronavirus patient in Singapore.
It was just 2 days before the first case was recorded in Australia. But while Western nations were waiting to see how serious the problem became, Singapore was already on a war footing.
From the moment, end of December, when we heard that this was going on in China, we slipped into action very quickly.
Australian expatriate Professor Dale Fisher is an infectious diseases expert at Singapore's National University Hospital and a key advisor to the World Health Organization.
I remember on January the 1st about having the emergency department start to look out for people. Labs were in place for our first case and every public hospital laboratory was capable of doing tests. So we ramped up very quickly. And a virus that was bringing China to its knees, we had a lot of respect for.
Professor Fisher is now quite literally the public face of virus education.
The health minister was visiting my hospital, NUH, about a month or so ago, and he said, we need more experts like Dale out there being part of the messaging. So that afternoon, I was approached by people and invited to become a cartoon character. The COVID Chronicles were born. When all this settles down, I'll fade back into oblivion, but at the moment I'm busy trying to get the message out there.
Okay, well, what is that main message you want to get out there?
In general, it's that this disease can be contained. And if you don't contain it, then you can see the ramifications. That's called Wuhan. That's called Italy. But if you do contain it, that's called Singapore. That's called Korea, Hong Kong, now China, now that they've brought it under control. So That's my strongest message, is that it can be contained and everyone has a different role to play.
The government's response was visible within days of the first infection. Students and visitors had to pass temperature checks to be admitted to schools. Classrooms were fully stocked with hand sanitizer. Children were taught early how to avoid infection.
The newspaper telling us that the virus is now in Singapore. Coronavirus can make us sick. It can make us have a runny nose. Also, it might make us cough. How should we cough if we need to? Into our elbow. Very good.
At the same time, the government was activating a network of nearly 900 health clinics to be the first line of treatment. They're called Public Health Preparedness Clinics, or PHPCs, and they're medical centres or general practices equipped in advance to deal with a major outbreak.
How long have you been coughing for?
Few days.
Okay, so you're not too worried about that.
Okay.
Anyone at home having this?
So far, no.
Dr. Tan Tek Jack is one of hundreds of doctors who were given pandemic training before the virus struck.
We know how to take care of the safety of the patient as well as our own safety. And having peacetime training is useful during these emergencies. As we get activated as a PHPC, we were given priority over certain protective equipment, such as masks, gowns, as well as gloves.
Critically, they also stopped infected people crowding general hospitals and spreading the disease.
We set up separate triage areas to discern the patients, the high-risk patients from the low-risk ones, and we seat them separately. Having PHPC clinics in the community really helps because in terms of accessibility of services, and then also preventing patients from going to hospital unnecessarily. And having PHPC clinics to do this job is better than to have patients, for example, mingle in the hospital and catching unnecessary infections.
Encouraging people to go to clinics for triage meant Singapore could quickly ramp up testing.
As we ramped up, we realised that if we only looked at travellers from China, then we would only find travellers from China. And we decided that we'd have an enhanced surveillance system, and any hospital admission with an acute respiratory illness would be tested. Atypical pneumonias could be tested. So it became quite liberal very quickly, because identifying cases and that early diagnosis is really key. And Eric, in many ways, this is a luxury, because we faced almost the whole SARS outbreak without a test. We had to do that on clinical grounds.
Singapore had spent years preparing for this kind of epidemic because it suffered something similar in 2003. A mysterious disease arrived from China called SARS, Severe Acute Respiratory Syndrome. 238 people were infected, 33 died.
This is something that is firmly etched in Singapore's medical history, and I think there was a firm conviction that this wouldn't be allowed to happen again.
Benjamin Low was a nurse in the SARS crisis. He's now head nurse in a hospital that was purpose-built to handle the next mass outbreak.
Building on our SARS experience, we saw about 300 over patients back in SARS, and this was why we actually built this building to actually hold up to 300 over patients. But in case of need, we can actually scale up to 500.
This is where all people who test positive to coronavirus are taken. They're treated behind double doors in so-called negative pressure rooms, where only fresh air can come in and only clean air gets out.
This actually protects the community that is residing near the building itself, and to assure people and the general public that they are very safe. So this is our assurance to the general public, and also our commitment in terms of protecting the lives of Singaporeans.
Patients who test positive have to stay in this hospital. Unlike Australia, there is no self-isolating in the community for anyone infected. And from the outset, Singapore has taken a harsh line on quarantine. In February, Dale Fisher was ordered to stay home for 14 days after he returned from a medical fact-finding trip to China.
If people are breaching quarantine and they're caught, then that's a potentially criminal offence. There are jail terms. You can lose your work permit, fines. So there's significant deterrent to breach quarantine, but there's also monitoring. When I was in quarantine, when I came back from China, I was quite surprised actually. I had an SMS and it said that I had to click on the link and that would verify that I was at the address I was supposed to be at. And when I clicked on the link, I got an immediate response saying, "Thank you for your cooperation." So they're watching, and that's good.
If that sounds like Big Brother, it's nothing on the steps taken to trace infected patients' contacts. Inside the College of Medicine, a special health ministry unit has been using detective work and technology to find coronavirus clusters.
Do you work on Saturday as well, or so is your off day?
Are you currently well?
So that's the session with your personal trainer. And after that, where do you go for dinner?
Officials like Dr. Olivia O track where every patient has been and find everyone they've interacted with since becoming infected.
If we are able to identify all contacts of a case early on, before they develop symptoms, then we will be able to break the chain of transmission. And also by identifying contacts early on, they will be able to be referred for medical assessment as early as possible. So far, we have managed to link up most of the reported cases. So as long as we are able to establish linkage with previously reported cases, we are quite hopeful that we will be able to contain this.
By the beginning of March, coronavirus and the COVID-19 disease were sweeping the world. But Singapore, with 5.5 million people, had kept infections to just over 100 cases with no deaths. The World Health Organization singled it out for praise.
We're very impressed with the efforts they're making to find every case, follow up with contacts, and stop transmission. Singapore is leaving no stone unturned, testing every case of influenza-like illness and pneumonia, and so far they have not found evidence of community transmission.
But Singapore's success in tracing relies in part on the infrastructure of a surveillance state. Residents are being encouraged to download a tracing app that lets authorities check where they've been and who they've been close to. This is not a democracy in the Western sense. It's been ruled by one party since independence in 1965. Dr. Simon Baptist is head of the Economist Intelligence Unit.
It's almost impossible to go anywhere in Singapore and not be on a CCTV camera. Plus, the government has access through many of the state-owned companies to a lot of data about transactions people are making or places people are going, which in other times we would say, maybe is an imposition on civil liberties, or we might worry about the uses that governments might put that to. But certainly in the middle of a pandemic, that's given people the confidence to continue to go out, because people in Singapore feel like they know where the cases are, they know where the risks are, and so they can adapt their behaviours in ways that means they're confident there's a very low risk of exposure.
For most of this crisis, cafes, restaurants and bars have stayed open, thanks to low levels of local infections. But it has meant major adjustments.
I'm Galvin, so I'm an assistant manager of Darkland PLQ. So remember to wash your hands later after you don your mask, so prevent your saliva from dropping onto the customer or onto their food. Okay? First thing that we do nowadays, we have to do sanitizing. We wash our hands, sanitize, so that we make sure the place is fully clean. 35.7. Thank you. Welcome to Duckland. Most of the customers that comes here, they say that this place makes them feel safe. So coming here with these measures being put up, they come back again.
As the virus spread around the world, Changi Airport remains an international gateway, using thermal scanning to check arriving passengers' temperatures. People kept going to work, and they've continued to use public transport, thanks to efforts to make buses and trains as clean as hospitals. Michael Lowe is a bus captain.
All staff, before they start work, are to take the temperature first. Secondly, buses every day are being disinfected. And each trip, when we reach the interchange, all doors and windows, after parking, is being opened to let the inside air to be filtered out first.
With few cases of community infection, most people felt safe to have their children in school.
We want the children to understand that despite the situation right now, as long as all of us have the common faith, we do our part to keep everyone safe, we are able to overcome this crisis.
Wan Jun and Pavitra are form teachers of a primary 1 class.
If you want to fight the virus, wash your hands, wash your hands. If you want to fight the virus, touch your face, so touch your face. Healthy meals and exercise. Okay, let us change.
Virus can be anywhere. If they spread inside your mouth, you can be sick or you can be die.
They say the constant hygiene lessons help calm the children's fears.
I'm scared my family die.
In class, we actually go through about feelings. So when they share their feelings, we really reassure them and tell them, there's no need to worry. If we take precaution measures and we practice good hygiene, everyone will be safe.
We find this is such a good opportunity for us to actually inculcate in them the values such as responsibility and resilience. Responsibility in terms of you being responsible for yourself, your own hygiene, and of course the social responsibility towards in keeping your friends, your family members safe.
None of this has been a knee-jerk response. Thermometers have long been standard issue for back-to-school kits, and schools have spent 2 years preparing to put classes online.
Solving one-step word problems.
If schools had to close, we will still use Student Learning Space as a platform to upload lesson packages so that students do not miss out on any of their learning.
And in a very Singaporean way, they're taught to show respect to older people working.
Can you show us your card?
Who would you like to thank?
The security guard.
Thank you to security guards. What do you want to say?
Taking our temperature.
The public mood hasn't always been calm. Panic buying broke out in early February when the government raised the alert level.
Today, the task force has deliberated carefully and decided to raise the risk assessment to DORSCON Orange.
But it stopped almost overnight after Prime Minister Lee Hsien Loong addressed the nation.
Fear can do more harm than the virus itself. It can make us panic or do things which make matters worse. Like circulating rumors online, hoarding face masks or food, or blaming particular groups for the outbreak. Instead, we should take courage and see through this stressful time together. Let us stay united and resolute in this new coronavirus outbreak. Take sensible precautions, help one another, stay calm, and carry on with our lives.
One common theme across the East Asian societies that have dealt with coronavirus quite effectively, Singapore, Japan, South Korea and China, is they do all have high levels of trust in government, and populations there are happy to do what the government says and are happy to go along with government advice. Singapore's also got a feature of not having a free media. So this means that in normal times you'd say there's not a diversity of voices and there's very little real debate about issues of domestic politics in the public sphere in Singapore. But in a situation like coronavirus, that has helped the government to control the flow of information. And so all of the information going out through the broadcasters, both print and TV and radio, is all effectively government approved. And so it means that it's harder for misunderstandings or unhelpful information that's not conducive to public stability to be propagated in Singapore because of that.
Many have seen it as their patriotic duty to spread the government's message. Eugene Lee and his wife Ski developed a site to give health information in different dialects.
We're thinking in our hearts, what happens to all these seniors that have no idea, don't speak English, nor Mandarin, and usually mainstream media, when they're reporting about coronavirus, it's always in terms of English or Mandarin. And we thought, actually, outside the nursing home, dialect-speaking seniors would also benefit. It's only when they protect themselves that, the society becomes safer.
A community group has been taking that message out on the streets.
I let you own one mask, all right? But the mask, remember, is only when you are sick.
Operation Hands On has volunteers taking masks and hand sanitizer to older residents and showing them Eugene Lee's multi-dialect videos.
In Hokkien, we have a phrase to say, "ai zai, mai kia," right? So, which means to stay calm, right? Don't panic. I think that's would be a first kind of best response, right? To see how each of us can work with one another in order to ensure that we come out of this together stronger as Singaporeans.
The sense of normality is tenuous. The Health Minister, Gan Kim Yon, has warned repeatedly that tougher restrictions may be needed.
We continuously adjust our risk assessment based on global and regional developments and adjust our measures accordingly. We will not hesitate to take further decisive measures to keep Singapore safe, as the situation warrants.
Dale Fisher believes Singapore right now is enjoying more civil liberties than Australia.
Eric, ironically, they're being enhanced. The fact that we're being very strict with a very small number of people for a very short period of time is allowing the majority of people the freedom they're used to enjoying. And life in Singapore really isn't a lot different. There's been a lot of adaptation, of course, but schools are open. Children are being asked to not attend if they're sick, to minimise any concerns. But we believe success looks like this.
But that success is being sorely tested, and some caution it's too early to celebrate.
Okay.
Professor Raina McIntyre heads the biosecurity program at the Kirby Institute in Sydney. She asked to be interviewed remotely. Such are her concerns about the virus's transmission. Well, Raina, a lot of people saying Singapore has done very well and could be a model to follow. You're less enthusiastic. Why is that?
Well, when looking at all the countries who've had epidemics so far and the data that's available, Singapore, Taiwan and Hong Kong look pretty similar. They all had some early success in keeping cases down, but they're all seeing an increase in cases at the moment. So it's far too early to be saying that's a success.
On the other hand, can you say that they have managed to slow what would otherwise have been a kind of Italian or Spanish rise of infections if they hadn't taken those steps so early?
Yes, I think they did test very extensively, which is really important in the response. And they also had fever screening in schools and other measures. And Singaporeans apparently are more likely to keep their kids at home when they're sick, which, doesn't happen in Australia.
But you still think it's a little bit early to be popping the champagne corks and saying the crisis is over?
I think so. I think the crisis is not over by a long way, not for anyone in the world. I don't think Singapore is out of the woods either. I'm watching with interest, but I don't think they can be too confident that they've conquered the problem.
The past 2 weeks have seen a dramatic spike in infections, mainly from Singaporeans flying back home. Cases rose from just over 200 to more than 800, with the first 3 deaths. The government's response was blunt and swift. On Thursday, authorities shut down bars, cinemas and nightclubs until the end of April, with new laws threatening 6-month jail terms for people failing to keep a metre apart in public. Changi Airport pulled down its own shutters.
When you face yourself in a situation where many countries don't have the control you'd like, and indeed it's like 3/4 of our cases were all off planes in the previous week or two, then it just becomes time where you say, well, we have to stop that leak. So, there's very major restrictions of people allowed in now, and if you do come in, then you're on quarantine at home. So we believe we've turned off that tap. I think we might see the numbers go up a little more over the next week, but then I think they'll come down.
The second wave has confirmed that there's no magic bullet to beat coronavirus, and it's far too soon for anyone to relax. But Singapore's experience has also shown that the virus's rise can be slowed as long as countries act quickly and comprehensively. The weapons in this war are extensive testing, strict isolation, thorough contact tracing, and perhaps, above all, community cooperation.